Many countries around the world battle second, even third waves of the coronavirus. Life in Taiwan appears near normal. The reason? Its success with battling the pandemic. The numbers tell the tale. A little more than 1,000 registered cases and only 11 COVID-related deaths for a population of nearly 24 million. Strict quarantine controls and test and trace are being attributed to the island's remarkable success in keeping case numbers low, something that was visible when a small outbreak hit a large hospital back in January.
Located near the airport, Taoyuan Hospital was one of Taiwan's gatekeepers against the virus. Authorities have sent a fifth of confirmed cases here for treatment since the start of 2020. But in January this year, an infected doctor triggered a fresh outbreak. Several of his co-workers were later tested positive. Taiwan faced its biggest coronavirus crisis since the start of the pandemic.
Hospital-acquired infection is very serious and hard to control. Patients in the hospital need healthcare workers to take care of them. They're next to each other. It's impossible to just quarantine hospital workers and leave patients alone.
Wang works at the Central Epidemic Command Center. He soon decided to set himself up in the hospital to directly oversee communications from the command center.
We had to contain the virus. Time was key.
In a large hospital of more than 2,600 employees and around 700 inpatients, one wrong decision could lead to the tragedy similar to the 2003 SARS outbreak. Then the government locked down a hospital where even healthy people were not allowed to leave, leading to 154 infections and 31 deaths.
It was okay when there were only 1 or 2 cases in the hospital. But when there were more and more people confirmed positive, we were definitely nervous. We were afraid of getting phone calls in the middle of the night, hearing about yet another new case.
This time, the command center reacted quickly, tracking all possible contacts and home quarantining over 4,300 people. They also transferred negative tested patients to other hospitals to decrease the workload on staff. After 14 days with no new confirmed cases, all hospital employees had to do mass testing to convince the public that the hospital is safe. In 44 days, the outbreak was contained with only 21 cases and just 1 death.
Transparency and honesty is very important, and you have to give the people the reason why you want to have a very stringent contact tracing and very stringent home quarantine, and the evidence. We have to show the evidence that it is very, very useful.
To prevent the future pandemic, Chen said no countries can fight alone.
I would like to re-emphasize the important thing is the prudent surveillance. We have to keep eye on the possible outbreak in all the countries to prevent its spread out.
Now, Taoyuan Hospital is back to relative normality. The SARS experience reminded the government and its people not to let history repeat itself. A lesson not only for Taiwan, but for the world in its approach to tackling this fast-spreading virus.
Jay Patel is a researcher on global COVID-19 strategy at the University of Edinburgh and joins me now from Leeds in the UK. Jay, welcome. Now, you study global responses to the coronavirus pandemic. In your assessment, what has Taiwan done well?
Hi. Well, Taiwan focused very early on having an elimination strategy. They were not keen on this idea of having community transmission where we've got the virus circulating in a population. So had a very early, very rapid and focused effort to eliminate any cases and clusters that were emerging from the initial China connection.
And how were they able to implement this so effectively? Did they have any previous experience with tackling pandemics that came in handy?
Well, the SARS pandemic of 2003 certainly came in handy. They had the planning, they had the pre-COVID infrastructure to deal with pandemics well. But above all, they recognized that acting quickly and trying to protect public health, first of all, in an attempt to recover economies after the pandemic were crucial, and certainly applied those lessons to COVID-19 very well.
It would appear that what you're saying is quite, it makes a lot of sense, to put it simply. I'm just wondering why other countries could not draw this same lesson early on in the pandemic.
It's a difficult question to answer, but perhaps one of the reasons is adopting an influenza approach, a flu approach, which many Western countries had, rather than a SARS plan. I suppose the primary difference between the two is that flu favors some level of endemicity, i.e. some circulation in the population to build immunity. Now, the problem is that SARS coronavirus 2 is much more lethal, it's much more transmissible, and so that approach just simply would not work.
It is also down to the fact that earlier on in the pandemic, it wasn't really well known how infectious the new coronavirus is.
Possibly, yes, but in a respect that actually enforces the need to drive down cases to as low as possible, as quickly as possible, when there are so many unknowns. Exercising what's called the precautionary principle certainly has a lot of value. And in the Western countries, we didn't really see that approach. Instead, what we saw was a firm adherence to the existing flu plans, which were clearly not compatible with this virus.
Right. We'll leave it there for the time being, but thank you so much for joining us, Jay Patel from the University of Edinburgh.